We are live. This is awesome. Howdy do. Hello, everyone. Aaron Boster here. And thank you, as always, for learning about MS with me. I have a special guest right there. I am super excited to introduce to you something very, very special that we're going to be doing tonight. This is Carolyn Conway. She's joining us from The Ohio State University. And we're going to be having a very special educational presentation tonight. Now, as always, I want to give a few minutes for everyone to jump online. As you jump online, make sure you tell me where you're jumping on from. I love watching this growing global online community. So tell me where you're coming in from. And hey, Matt, how are you doing? One of our wonderful moderators is on. Kelly, howdy do. Gloria, hello. Jane is on the line. Mike, another one of our awesome moderators. Kelsey from the MS Center is in the house. This is fantastic. There are 64 of you coming online. Let's give it a few more minutes. O'Connor from Ireland. Hello, Lorraine. How are you?
Wow. People from Texas, all over. Oh, wow. We're really rolling in now.
Winnipeg is in the house. Oregon is in the house. We got Los Angeles in the house. Don't forget Utah. Hello, Carl. So we've got 69 folks, and let's give it a couple more minutes to let everyone online. I am so excited for what we're going to be doing tonight. King Dog White from Alberta, Canada is here, and we've got Brad from Greenville, South Carolina. This is wonderful. Now, we're going to be doing some really cool things tonight. I have a couple very quick clinic announcements. I am tickled to death to introduce you to Caroline, to talk to you about her subspecialization and how it's going to up our game tonight. And at the end of the hour, we're going to do some Q&A. So let's give it exactly one more minute. We're going to be doing the MS Water Challenge all night. You got to have your water, and then when I drink, you drink. All right, so let's practice. MS Water Challenge. Hoorah. Okay, so we've got 70 people on. It's about time to get started. Howdy do. Aaron Boster here with the Boster Center for MS. You are joining me in my monthly educational live stream. The Boster Center opened up 2 days before the global viral pandemic closed the state of Ohio. And so we're looking about 20 months in at this point, literally exactly during the time of the pandemic. And it has been an absolute pleasure to connect with you and your families through this forum once a month. And so today, we brought a very, very special guest, Caroline. And before I introduce Caroline, I just want to share something which is so special to me. I want you to take a look at this amazing watercolor painting. So this was painted by a very special woman who's a patient of mine in Ohio. And she made a watercolor of my dog and I. And I am just beyond touched. I'm without words. It is so very special. This will be hung in the office, and it's a joy to look upon. And I just wanted to say thank you. I'm not going to say your name, but I love you, and I'm so very, very appreciative. Thank you so much. So I had to share that. Now, there's 85 of you that are here tonight. It is such an honor that you're giving up part of your evening, and you are about to be in for the treat that you did not anticipate, and it's right over here. Carolyn Conway is an amazing young lady that I met a few months ago. She's actually in her second year of graduate school at The Ohio State University Medical Center, where I used to be a professor, and she's studying speech pathology. Now, prior to this, she did a 4-year undergraduate at The Ohio State University, where she studied speech and hearing science. And speech pathologists are a key team member in your village trying to up your game and live your best life despite having MS. Now, Carolyn has a very personal connection to MS. I'm going to let her share that. And we were recently graced with her presence. She came and hung out with us for a day in clinic. We had an awesome time and saw a lot of patients together. And she has volunteered to come on tonight to educate us about what a speech pathologist does, with specific focus on 3 areas that are key importance to MS. So do me a favor. Help me welcome her onto the show by filling up the entire chat with flames. That's how we are going to show her love. Flame up the chat for me so we can say howdy do and welcome Caroline. Show me some flames, guys. And there you go. So Gloria has got the ball rolling. Oh, here we go. So, here you go. Look at that. Shannon, thank you so much. If you feel the love, go ahead and flame up the chat. Kieran Tweed is doing it up. Thank you guys.
Here
awesome.
we go.
John
Look
Scapino
at
is in the
that.
house. All right, so it is time. I'm going to turn this proverbial mic over to Caroline. And if you have pen and paper, guys, get them out, because this is a tour de force things that you're not going to hear anywhere else. Caroline, welcome so much. Thank you very, very much for being here. Tell the people a little bit about yourself and teach us.
Yeah, for sure. Thank you so much for this opportunity. I am so excited to be here tonight. This is something I've been looking forward to for a really long time. And I'm just so honored and excited to get to spend the evening with everyone.
We are happy to have you.
Thank you. Yes. So as Dr. Boster said, my name's Caroline. I am a second-year graduate student studying speech-language pathology at Ohio State University. So I did 4 years of undergrad also at Ohio State, and now I'm in my second year of my graduate program. And so kind of the pathway for speech pathologists to become speech pathologists. So you do 4 years of undergrad studying speech and hearing. Then you go to graduate school, which is a 2-year program. And then after that, you have a 1-year clinical fellowship. So then after that, then you apply for your competencies, and then you can finally be a speech pathologist. So I'm nearing the end of my educational pathway, which is why I feel like I have some more knowledge now that I can share with you guys.
I wouldn't be surprised if plenty of people didn't know the amount of school necessary.
Yeah.
So you're really talking about 7 years before you are interfacing with the patient on your own.
Yeah, for sure. So during that clinical fellowship, you're working essentially on your own, but you do have a supervisor. So you're not totally, thrown to the wolves yet. But then, after that, then you're kind of on your own. So I kind of came to this position and being interested in multiple sclerosis because of my mom. In December of 2015, my mom was diagnosed with MS after about a year of, having some symptoms and being bounced around to a handful of doctors and, getting some different diagnoses. MS is kind of what everyone settled on. And so since then, this is something that she and my family have been tackling. And so I have a really close personal connection. And I've been interested in the disease specifically from a speech pathology standpoint. So that's kind of what I'm here to talk with you guys about tonight. So I discussed a little bit about the educational pathway to becoming a speech pathologist, but then now we need to talk about what is a speech pathologist, because that's probably a term that not too many people have heard before. So some people might know what a speech pathologist is because maybe you had a child who couldn't say their R's, or maybe you have a family member who has hearing loss, and speech pathologists totally help with those things. But tonight we're obviously going to talk about our role, specifically working with adults with MS.
So this is a little bit different than the speech pathologist that would be hired by the public school system to help kids with their pronunciation and stutter. This is more of a medical bent.
Right.
And you kind of see where you're positioning yourself to be working with people that have neurological conditions.
Absolutely.
And it's a little bit of a different slant.
Right. So we all kind of get that same education in undergrad and grad school, but then you kind of specialize. So you kind of decide, okay, what am I really interested in? Do I want to work in schools with kids with articulation and language impairments? Do I want to work with people with hearing loss? Do I want to work in a hospital? And so for me, I'm really interested in the medical side of the field. And so with the medical side of the field, the 3 big things that we focus on are speech, swallowing, and cognition.
And I'm going to just type this in while you're talking.
Yeah, for sure.
Speech, swallowing, and cognition.
Yep. So for speech, actually those speech movements. So there's a lot of things that have to happen for you to get those words out. So your brain has to communicate with your mouth and your lips and your tongue and your teeth. So that's kind of the speech part. Then we have the swallowing part. So, we don't think too much about it when we're eating dinner with our families, but there's a lot of muscles and a lot of things that have to happen for us to swallow safely and efficiently. And then cognition. So that's the last thing we'll be talking about tonight, but that refers to all those different mental processes. So all the things that your brain is doing.
I have to be honest, when I started in the field of neurology, I didn't know about the expertise of speech path with cognition.
Yeah.
And the first time a senior neurologist said, well, refer them to speech pathology, I said,
What?
why? They're not having any difficulties with pronunciation.
Yep.
And it turns out that you guys are amazing at what I essentially call cog rehab.
Yes, exactly.
So I leverage people like you to rehabilitate thinking and memory.
Yep.
The way I would leverage a neurophysical therapist to help with walking.
Exactly. That's
very,
right.
Very powerful stuff.
Yeah. Well, thank you. I appreciate, you kind of acknowledging that, because I feel like, people just don't know. People don't know that speech pathologists have this specialized knowledge in cognition and the rehabilitation that goes along with that. So we're going to hit on that at the end. But the first thing that we're going to talk about tonight is dysphagia. So dysphagia is the big fancy medical term for difficulty swallowing. So having problems with your swallowing. So phagia is the kind of Latin term for eating, and dys means it's not working too well. So dysphagia, eating isn't going too well. That swallowing portion, there might be some deficits there.
So not only is that an important word to understand, but if you're playing Scrabble with your family later, you're guaranteed to get like 12 points. Dysphagia.
Yep, there you go. So that's a winner. So some symptoms of dysphagia that you might experience would be coughing while you're eating. So whether that's with liquids or solids, if you're noticing a lot of coughing, that's something to monitor. If you feel like something's kind of going down the wrong pipe, and on occasion that's normal, something just kind of goes down the wrong pipe and you cough and you get it out. But if that's happening a lot, that's something to really be aware of and to let your physician know about. Another symptom we can see is trouble initiating a swallow, especially with MS, because it's, has to do with that muscle weakness. There's a lot of muscles up in here that are involved with swallowing. And if they're not all working together, you might be ready to swallow and have that food or drink in your mouth, but those muscles might not all be coordinated correctly.
They didn't get the memo yet.
Yeah, exactly. Right. So your brain's telling you it's time to swallow, but those muscles aren't quite listening. So that's definitely something that we can see too.
So when we talk about dysphagia, I think it's important to bring up that about half of people with MS have dysphagia, but they don't realize it. So if you are having any suspicion, coughing, sputtering, gasping when eating, that's a real big red flag. I mean, the hairs on the back of my neck stand up when I hear that. At the risk of being a little bit morbid, there's 3 ways that people impacted by MS can die. One of them is urosepsis. One of them is a bed sore. The third way is aspiration pneumonia. So if you're listening to this and you sputter and cough when eating or drinking, you need to talk to your neurologist, and you need them to ask them to send you to Caroline or someone like Caroline so that we can help figure that out.
Yeah, exactly. That is the biggest thing. And so we're going to talk about aspiration pneumonia, kind of what that is and why that's so important in just a second. But I want to back up for a second and just talk about why swallowing is so important. Number one, it's socially important. We all like to eat dinner with our family. We all like to go to our favorite restaurant. A lot of times when we make plans with someone, it's, hey, do you want to grab coffee? Or do you want to try that new restaurant tonight? And if you're having trouble swallowing, that can really deteriorate your quality of life. If you're nervous to go to a new restaurant, or you feel like it's inhibiting your ability to socialize with others.
That is such a good point. There's a major issue in MS, and that's social isolation. And that's an example of social isolation that I never thought about, where someone might say no to a dinner date because they're embarrassed about potentially choking when they eat.
Yeah, exactly. So that's kind of thing number one, why we care about swallowing. And also, it's medically necessary. We need to be meeting all of our nutritional and hydrational needs, ideally by mouth. And so making sure that you're getting enough calories and that intake is providing you with enough energy to sustain you throughout your day. And then also, what can happen if the swallowing isn't, working correctly can be that aspiration pneumonia. So basically what would happen is if your airway isn't protected, so there's 2 tubes when you swallow. You have your esophagus, which is that back tube, and then you have your trachea, and that's your front tube. Your trachea leads to your lungs.
Yeah. You don't want food in the front tube. You only want food in the back tube.
Yeah, exactly. So when you swallow, you want that food to be going down the back tube to your esophagus, which leads to your stomach. But if you're having trouble swallowing and it's going into that front tube, it can go into your lungs. And what can happen is that bacteria can grow and it can cause pneumonia. So one important way that you can prevent aspiration pneumonia is by having really good oral hygiene.
Mhm.
So making sure you're brushing your teeth at least twice a day, especially if you're having difficulties with your swallowing. Because what that does is it cleans out your mouth and gets rid of any of the bacteria that might be in there. So if you are to swallow and it were to go down the wrong pipe, it would be clean and it wouldn't be carrying bacteria with it. So really making sure you're brushing your teeth, flossing, using mouthwash, all that good stuff is one way you can also prevent aspiration pneumonia.
Now, some people with MS struggle to use like a manual toothbrush because of the dexterity that's involved. And so I think that, nowadays they make relatively inexpensive electric toothbrushes.
Yeah.
They're not even fancy anymore.
No, you can get them at a drugstore.
You can pick up an electric toothbrush, and if you can just click it on and push it to your face, it's going to help get your teeth really pearly white. And you're absolutely right. That's a really, really good idea.
Yeah. So just being aware of that. So with dysphagia, if you are experiencing these symptoms and you go to your physician and he refers you to a speech pathologist, they're going to do a swallow study. And so this swallow study is going to be called a modified barium swallow. So we abbreviated MBS. And so basically what it is a video x-ray of you eating and drinking. So they give you different textures of food, and they put barium in it, which is the stuff that makes it light up on the x-ray. Because if we just gave you normal food, we wouldn't be able to see anything on the x-ray. So we need to put some stuff in there.
I'm going to try to find a picture of a barium swallow.
Yeah.
Maybe I can show it.
Yeah, that's a great idea. And so what they do is they have you eat and drink different things and they see exactly what's going on. So maybe it's an issue with your tongue and it's not pushing the food back, or maybe it's an issue with your throat muscles. Yeah, so that's what it looks like. So you can see the food being pushed back and going down their esophagus. It's really, really cool.
And without derailing where you are, you'll get into very specific phases.
Yes.
Like, so the front of the mouth is a different phase than the back of the mouth.
Yep.
And so you can look at that and start to really get granular about where the problem is.
Exactly.
Sorry, I just want to share
Yeah,
that.
no, for sure. Cool. Yeah, that's great. Just giving people kind of a visual with what exactly is happening when you do the swallow study and what we're looking for. And so like Dr. Boster said, we kind of examine it and we go frame by frame to see, okay, what muscles are engaged? What muscles aren't engaged? What is the issue here? Why is food going down the wrong way? And what are we going to do about it? So that brings us to our treatment for dysphagia.
Now, real quick before we jump into that, does it taste bad?
It doesn't taste great, to be honest. It kind of tastes chalky.
Okay.
Yeah.
And is it expensive? Do you know?
Barium?
No, to get a barium swallow test. Like,
I'm not super familiar. Insurance obviously plays a role in it, and it depends if you go through like outpatient. I guess you would mostly be going through outpatient. I don't really know.
I'll share that, at least in my experience, it's never rejected because I think insurance companies recognize the importance. And so I would expect that if your neurologist referred you to a Caroline, that it's very, very likely going to be covered because it's a very appropriate thing to do.
Yeah, awesome. Perfect. So that brings us to our treatment for dysphagia. So there's kind of two main lines of treatment. Number one would be swallow strategies. So things that you can do to strengthen those muscles and to help you get the food down and going where we want it to. So just a couple of examples and things that you can implement in your daily routine right now if you're having deficits with your swallowing. Number one would be always making sure you're sitting completely upright when you're eating. You cannot eat safely if you're laying down. If you're like this, things are likely to go the wrong way. So always making sure you're sitting all the way up.
This is important because many, many red-blooded Americans do not eat at the dinner table. And so if you're used to putting a plate on your lap and watching television and Netflix, you're setting yourself up to choke. And so we're talking about in a hard back seat, sitting, upright.
Yep.
Very important tip that all too often we just skip.
Right. So always sitting upright, tip number one. Number two, taking small bites and small sips. So I know if you have this beautiful dinner and you want to just throw it all in and, scarf it down, it can be tempting. However, taking small bites and small sips is one easy way that you can, decrease those risks of things going the wrong way.
So let's demonstrate. So give us an example, if you would, of like what you would consider is like a good small sip.
Okay. So it should really only require like one swallow. So it's not like you're chugging it down. If you're having to swallow and swallow and swallow,
That's too big.
That's way too big.
All right, so that's a huge tip. So if you put enough liquid in your mouth that you can't swallow it in one go, that's too much. So let me try to do a good swallow.
Yep, we're sitting upright.
All right.
We have one swallow.
Woo!
And it
All
went
right.
down because we're not coughing, we're not throat clearing, we know everything passed clearly.
Awesome.
Perfect. So those are two easy tips. And then the third one that you can implement is going slowly. So taking your time while you eat. This is also helpful for like digestion and just making sure your food is being processed. But, you know, again, if you're shoveling food in your mouth, you're more likely, your muscles are more likely to get confused and to get, you know, kind of out of whack. So they need that time to process, to send that message from your brain to your swallowing muscles, chew it up, and then send it down instead of shoveling it all in and then you're coughing and choking and things get out of hand.
Another time that I think we're at significant risk is when we try to talk and eat.
Yes, that's
Now-
a huge one.
Now, we shouldn't do that anyways. And I've choked talking and eating, or I've coughed talking and eating. But in the setting of multiple sclerosis, if you have any dysphagia, even like a little, and you're trying to do something like talking and eating, you're a setup for choking.
Yeah.
And so, you know, not only do I want you sitting upright at a table with small bites, but
Try an effortful swallow. You'll feel this part right here. This is your voice box.
and
It
you like
goes up.
you like try to just focus on it or push on it.
Yeah. So really focus on swallowing, pretending like you have like a big golf ball stuck in your throat and you want to get it down.
All right, let's do it on the count of 3, guys. So if you're listening to us, swallow with us on the count of 1, 2, 3.
Can you
All right.
feel those muscles
Yeah.
really engaging? And so just like if you go to the gym and you work out your arms and legs, you can also work out your swallowing muscles.
Mhm.
And your speech pathologist can give you more specific tips based on your specific type of dysphagia. But that's just an example of something they might have you do, like 10 set or 3
Reps,
sets
yeah.
of 10 or whatever.
When would a straw be important? When might that be like a good adaptive measure, and when would it be a bad adaptive measure?
So straws are tricky. So for some people, straws are totally okay and they can swallow with them and everything works, especially if you have motor deficits and it's harder to pick up the cup and it can spill out the sides of your
So then
mouth.
if you can put your lips on it, and you
Yeah.
can drink.
Yeah. So if you have that good oral closure, so if you can get your lips around a straw and safely swallow, that's a great option. Where straws can be kind of problematic is if you have dysphagia, pharyngeal phase, which is like the swallow or the like kind of throat phase, and if it's going over into your pharynx before your muscles are ready, then the straws can kind of be problematic because people are more likely to drink quickly with a straw. I know, if you go through McDonald's and you get a Diet Coke and it tastes so good and you're slurping it down, rather than, if you're taking a second to sip and set it down. So straws.
So you would actually not recommend a straw as a technique. You would put that aside.
Yeah, for most people, we don't recommend straws.
What about a chin tuck?
A chin tuck?
So when you were
Yeah.
doing this, I thought we were going to do a chin
Yeah.
tuck. So when might that be like a thing that you would recommend to someone?
So that's also helpful if you're having, it's called premature spillage. So it's basically if the liquids are going down before your body's ready. And so what happens is if it falls down the back of your throat before your body is ready, then you can cough and choke. So doing a chin tuck, looking down and swallowing with your head down gives your, so it's kind of changes the gravity. So when your head's upright, obviously everything's kind of aligned. But then when you put it down, it forces the liquid to take more time because it almost has to go like up and over the back of
Does
your
that
throat.
help clear the front tube? Are you kind of protecting it in that regard?
Yeah,
All
it
right.
can also help with that too. It's kind of just trying to slow the process down,
All right.
basically.
Okay, cool. So a speech pathologist is going to do a barium swallow. You're probably also going to have them do some phonation and some things.
Mhm.
And then based on that, you're going to be able to sort out, okay, we think that dysphagia is here.
Yep. And then they'll give you specific strategies. So that's kind of the one aspect of dysphagia treatment is these compensatory strategies. So things you can do to help manage the symptoms. The other side of dysphagia treatment are modified diets.
Mhm.
And so this would be in the event that your airway is really, at risk and you're not able to protect your airway. And so the speech pathologist would recommend a modified diet. And so that might mean cutting foods up into soft and bite-sized pieces. So it would mean nothing hard, crunchy, gooey, things like that. So no gummies, no chips, because those things are obviously a lot tougher than scrambled eggs or, waffles cut up into pieces. So there's different levels of diets. We don't have to get into, all of that. But so that's an option. So changing your diet to help your swallowing improve. And then, so that can be with solids or liquids. So the other thing that we can recommend is thickened liquids. So there's these little packets of thickener, and you squeeze them into liquids, and it just makes them thicker. And there's different levels of thickness. Yeah, exactly. Of viscosity. Yeah.
So really, you're approaching every angle. You're saying, what can you do physically to change how you swallow? And what can you do to the stuff you're swallowing to make it safer?
Yep, right.
Are thickened liquids, do they taste different?
No, they don't taste different. It's just the thickness, really. So it's just the consistency that changes.
Okay.
And I've tried all of them. They're not bad. I mean, different things, I'll be honest, like thickened water isn't great because it's just kind of weird. But any kind of like juice or
like a slurry or something.
Yeah. Like things can like taste just, I don't know. It's just kind of thicker. But yeah, if it has flavor, so really anything other than water, I think is fine thickened.
How many sessions does the average person with MS who has dysphagia going to have with a speech pathologist? Is there like a standard, or is it super individualized?
I would say it's super individualized because it also depends too. So if you're doing these, if you're really independent with your swallow strategies and you're able to do them at home on your own, then there's not necessarily a reason for you to come in for 45 minutes a week and to just sit and swallow if you're able to do that on your own. So likely, I would say for most people, they come in, they get that swallow study, we see what's going on, maybe do a handful of sessions just to train those strategies. And it's all about giving those cues and teaching people how to do the swallow strategies correctly. And then if we have to modify the diet, doing a lot of education on what to eat, what not to eat, how to prepare food. But then people usually do pretty well as long as they or their caregiver are able to support them.
Awesome.
Yeah, the outcomes are good.
Dig it.
Yeah. Awesome. So that's all the kind of dysphagia stuff I wanted to talk about.
Now, before we transition, if you guys enjoyed that and you want to hear the next section, we need some more flames. So take a second and flame up the chat for me and let Caroline know that we appreciate her giving up her evening to up our game to help us understand better what's up with MS as it relates to swallowing. So flame up the chat. Andrea has got it going on, and Debbie Wood is helping. Green color star and there you go. All right, so we're getting some flames, guys. Let's get that whole chat flamed up. That's going to let us know that you're loving what we're doing. Yusuf, salut, mate. And let's start on the next section.
Okay, awesome.
I think that our audience is really, really keen. There's 102 people that have joined us so far.
Yeah, it's great.
That's really, really exciting. If you guys are liking this, another thing that you can do to show love is to throw a thumbs up in there. You got to jump out of the chat, click that thumbs up button, and jump back in. And according to my learnings, it helps the YouTube analytics.
Ooh.
But with no further ado, we're going to jump into the next section. What are we going to learn about next?
So the next thing we're going to talk about is dysarthria.
Dysarthria. Let me write that down.
So dysarthria is a motor speech disorder. And I want to really explain that this has nothing to do with language. This is a speech disorder. And when I say motor speech, that means it has to do with the motor neurons. So the neurons in your body that are telling your muscles what to do. So we're not saying this is a loss of language or the loss of intelligence. This is merely your brain telling your mouth to do stuff and the message getting a little messed up.
So that's a really important point. In neurology, the word language and the word speech are very different, and they mean very different things. So language has to deal with hearing someone speak and you understanding what they're saying, and then you producing a thought, and then you sharing it using language. When we talk about speech, we're talking about, as you said, making the sounds properly. Yeah. So I remember when I was learning a foreign language, I sounded funny because my mouth didn't move right.
Yeah.
And that was kind of a dysarthria of sorts.
Yeah.
So here we're not talking about language, we're talking about speech, the creation of the sounds.
Yeah, exactly. And so there's a lot of things that have to happen for you to produce speech. So we're going to kind of run through what those things are and how MS can impact these things. So first, you have to be able to breathe. You have to be able to time your speech with breathing. So we typically inhale and then we speak on an exhale. And so if your body, due to the different lesions or spasticity or muscle tone weakness, is having difficulty timing that speech with your breathing, it can sound a little off. So respiration, breathing is thing number one that has to happen for you to speak.
Do you ever recommend an incentive spirometer to people?
I've never had experience with that, but I could definitely see that being helpful. Have you ever heard of EMST, expiratory muscle strength?
Tell them about it.
So I'm a big fan of EMST. So EMST stands for Expiratory Muscle Strength Trainer. Yeah, exactly. So we're working out these muscles. So the muscles that are involved in speech are also involved in swallowing. So there's this little device you can get, the EMST device. And basically what you do is you set it to a certain resistance, and your speech pathologist would help you determine what this resistance is if you're having these weaknesses. And you blow into it, and you're blowing against resistance. So what it's doing is it's strengthening all these muscles, again, that are involved in speech and swallowing. So it's kind of similar, like that is obviously measuring kind of your breath support.
So in both cases, what we're talking about is strengthening the bellows. So these are muscles that we're talking about, and you can strengthen a muscle.
Yep.
Incentive spirometers are cheap as dirt. You can get them on, Amazon delivered to your house.
Yeah.
And it's a device that, I first saw in the hospital where it's got like a tube, and then it's got a little suction thing, and you go, and you suck in, and you can measure how you do it. But I like to get people sometimes, if they're having trouble with their bellows, it's a way of activating it.
Yeah.
And I'll ask them to use it like 6 times an hour when they're watching TV.
Yeah, right.
I think the device that you're talking about is taking that to another level. You're not sucking in, you're pushing out and really training. So is that something that you would only get by working with a speech pathologist?
Most likely, yes. I don't know if you can order them commercially. I've only used them in a clinical setting. They're kind of expensive. They're like $50. But they're really, really cool. And there's like a ton of studies with people with a variety of neurological conditions that it's been shown to help.
That's really cool.
Yeah, so that's something that you might hear. I saw someone in the chat saying, is dysarthria what Selma Blair has? Yes. So the speech condition, if anybody's seen her documentary that just came out, it's really fantastic. It's on Discovery Plus. Feel free to check it out. But so they talk a little bit about her speech, and dysarthria is that term for that speech condition. So we said that it can occur as a result of deficits with respiration, so that breathing. It can also have to do with phonation. So phonation is the fancy word for speech. So actually, putting your vocal cords together, they beat together like this. And so what has to happen is you take this deep breath in, and it sends a puff of air through your vocal cords, and they beat together really quickly like this. And then it comes up out through your mouth, and you shape the sound with your lips and teeth and tongue. But if you're having spasticity in here in your vocal cords, they can come together really tightly, and you can have the different vocal quality. So we'll talk about that a little bit in a second. So that's the second thing, phonation.
So first, respiration is involved in making noise, and then phonation, shaping the air coming out.
Yep, exactly. The next thing is articulation. So these are called your articulators, your lips, your teeth, your tongue, all of those things that help make the sounds that are involved in your mouth, your soft palate. So the very back of your mouth, if you run your tongue along the roof of your mouth, eventually it gets soft. That's really important for shaping speech too. And so again, all of these things can be impacted by changes in muscle tone, spasticity, where your lesions are. And then the last thing is prosody. And I feel like this is something that people kind of forget about, but it's super important. So prosody is basically intonation in your speech. So the natural ups and downs when you're talking. So
cadence.
Yeah, exactly. So we don't talk like robots. We don't sit here and talk like this.
We can talk like robots, maybe.
Yeah, so you can do that, but most people probably don't. And that's because we use prosody in our speech. It's what makes it sound natural. If you're excited, you might, sound like this. If you're down in the dumps, you might sound like this. So it's kind of the way that we talk. And all of these things can be impacted by dysarthria.
And so when you're listening to someone speaking, you're kind of taking all those different things into consideration to construct your thoughts on what's wrong.
Yes.
That's really cool.
Yeah. So speech pathologists are specially trained in hearing people's voices and kind of mapping those characteristics onto the impairment. And so it's something we learn in school. It's called ear training, and it's hard. It's something that I definitely still have to work on, but it's really interesting. And so that kind of brings us to our next point about dysarthria is like, what do we see in MS specifically?
Now, real quick, before we do that, a bunch of people are asking for the name of that device.
Oh, yeah.
So say it again. I'm going to type it in.
Expiratory.
So
XPI.
Oh, no, I was just going to do the abbreviation. I'm sorry.
Oh, EMST.
So look up EMST. It's an expiratory
Muscle strength trainer.
All
Yep.
right.
Yeah, they're super cool. They're like blue. They're about this big. Yeah, they're really neat.
All right, so I interrupt you. I
No, it's all
apologize. So
good.
we're going to talk about so you're thinking about the way someone makes sounds, and now we're going to focus on, in the setting of MS, what might we see?
Yes.
Or what might we hear?
Yeah, right. So there's a lot of different kinds of dysarthrias, and they're all impacted by where the disease is impacting your neurological system. So there's a lot of different kind of neurons and different parts of your brain. But for MS specifically, there's two different kinds that we typically see. So the first one is spastic. And so I'm sure a lot of you are familiar with spasticity and kind of what that involves with MS. And so when I was talking about your vocal cords and how they beat together like this, what can happen is if they're experiencing spasticity, they can kind of get stuck like this. And so when they're closed off like this, it's hard for that air to come up and for them to naturally beat together like this. So the vocal quality, it's kind of referred to as strained strangled. So it feels very harsh and like you're forcing that air out, and it's not very natural.
If I try to imitate it, it's very nasal type of talking. You're trying to force out the sounds. And it sounds like it's kind of up here. Is that's the way I typically hear it. And it's interesting that's burned in my brain because that's the way my uncle spoke.
Yeah.
My uncle had very advanced MS at the end of his life. And I remember hearing that as a child. And then later when I was in school and I heard that in the clinic, it really took me aback. And that's a spastic upper motor neuron pattern.
Exactly.
And what's the other one?
The other one is called ataxic. And so some of you might have heard the term ataxia. It's a general term kind of describing an incoordination or difficulties with balance. And so how that kind of relates back to dysarthria, it has to do with this like incoordination. And I know some people kind of refer to it as like that drunk speech. That's kind of how it sounds. So it's a little bit slurred. Maybe there's some irregular like articulatory breakdowns.
The cadence is involved.
Yeah. So we see that excess and equal stress. So instead of having that kind of prosody we talked about, everything can come out very similar. It's very halted, and it doesn't really have that natural cadence.
Or you could start talking and then get faster and then slow down.
Yep, exactly.
The cadence and the prosody is off.
Yeah,
kind of
those
like
timing breakdowns.
If you think about someone who's drunk and they're stumbling, they take irregular steps. Here, this is a similar phenomenon where they're saying things in an irregular fashion.
Yeah, exactly. So that timing breakdown, that incoordination, and again, this all has to do with those signals are being sent from your brain to your articulators, to all of these different parts, but they're getting a little messed up along the way. And so how it presents is, in a lot of different ways. These are just some examples, but those are the two most common kinds of dysarthria that we see in MS.
And this brings up an important point. Several people in the chat have said, "Hey, I talk like I'm drunk."
Yeah.
Which is socially stigmatizing. And there's a very common concern that you're pulled over by a police officer driving.
Absolutely.
And so what you're going to say is, "I have MS, breathalyze me." Don't use your cop test to figure it out because I might not fare very well.
Right. And I like how you brought that up, just being an advocate for yourself. And we're going to talk about that again with cognition and like taking brain breaks and all of that. But I think that's super important. Just learning for a lot of different things, advocating for yourself. And, if you're a family member of someone who has MS, being able to say, look, like this is what's going on. Like my family member hasn't had one too many drinks. Like they actually have a neurological impairment. Please, respect that and understand that this is what's actually happening.
Those are really important points.
Yeah.
Absolutely.
Yeah. So then I kind of want to talk about treatment for dysarthria.
Yes.
So what can we do about it? So the two kind of overarching goals for dysarthria treatment are improving speech intelligibility, so the ability for people to understand you, so to perceive what you're saying and to perceive it correctly. And then to increase that naturalness. So that prosody, the cadence, and kind of just talking like everybody else, like wanting it to sound natural. And so there's a couple of different things that we focus on in treatment. One of them is increasing breath support and being more aware of it. So really being intentional about that timing of the speech.
Talk.
Yes. Exactly. Talk. Right. Because what we see sometimes, especially with ataxic dysarthria, is people will breathe in and then they'll forget to talk for a minute. Like the timing gets a little weird. Or they'll, instead of, you're supposed to, breathe in and then immediately start talking on that air so you can talk for as long as possible. But what happens is that you might take that breath in, breathe out a little, and then start talking. So then you run out of air really quick. So just being really intentional about that, so we can give some strategies for that. And then the other thing is speaking rate. So, when you get excited or something, fun is happening, your speech kind of picks up, right? But that can be kind of problematic for people with MS because the signals are already getting distorted and then we're throwing that on top of it. And so it kind of can exacerbate those issues. So there's some external strategies, things like pacing boards. They're these little boards, they have like circles on them and you kind of run your finger along. And the idea is that you time your speech with hitting these circles. And so it focuses on the breath support too, but making sure that you're pacing your speech so you don't run out of air.
Can we find those online?
Yes.
So what will we search for to find a pacing board?
You could probably type in speech pathology pacing board, and it's nothing fancy.
Let's try this.
Don't get too excited.
Speech pathology pacing board. So if you guys are listening and you want to explore that, check out a pacing board and see what you think. I think that's a really cool tool.
Yeah, it's really neat. And something, even if you don't want to have something with you like that pacing board, finger tapping, you got your fingers right there. So making sure you're talking on the beat. And at first it might feel a little silly. Like it kind of looks weird. Like, what are you doing? But if you're having issues with your breath support and getting your speech out, it's definitely worth it to kind of being intentional because then it increases that intelligibility and that speech naturalness.
And if you're having ataxia, irregular speech, or a strangled speech, slowing down is a way to combat that, right? Because if you pick the cadence of your speech and it's slower and you have breath support, you're less likely doing this or to have an irregularity. So I think that's actually a really, and you don't have to tap your hand like this. You can tap your hand down here where nobody can see it.
Right. Yeah. And so that's another thing we also literally work on in therapy is doing this in a way, teaching people how to do this in a way that improves their speech, but also doesn't make them feel weird in public. You know, like those are things that, because we, want to improve that quality of life. And if you feel weird sitting at work doing this, like we can teach you ways to, hide it or kind of be, a little bit more discreet, but still use those strategies.
Yep.
And then the last thing that I want to briefly touch on, which most people for MS don't need. This is usually in very severe advanced cases, or if you're in the hospital and maybe having a procedure or having like a big flare up or something, there's something called alternative and augmentative communication. And so we abbreviate that AAC. AAC is fantastic. AAC is any mode of communication that's not verbal. So we all use AAC every day. Anytime you gesture, anytime you write something down, anytime you use a facial expression, that's all AAC. But there's also high-tech AAC devices that are available for people who have more severe speech problems. And so what they can do is provide another mode of communication. So they can be on like iPads or dedicated speech devices, and it has a whole vocabulary on there. And you can either choose them via pointing. They have ones that do it via eye gaze. The technology is fantastic. And so if you feel like you're having really advanced, severe dysarthria or speech problems, it's definitely something to look into. But I will say it's not super, super common for people with MS.
One thing that I wanted to chat with you about before we go on to the most exciting last topic is we're in this world of telemedicine, and there's so much of a neuro exam, which is challenging to do across a video screen, but evaluating speech is not. in many respects. And so I thought maybe we could go through some of the pa, 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 ta, ta, like sort of.
Yeah.
So there's a couple tests that I have done more during the pandemic than ever before, because normally the way that I evaluate the back of your throat is by shining a light and looking and having you say ah and elevate.
Mm-hmm.
But there are some sounds that can test various aspects of speech, which also test various parts of the brainstem. So I just go over those because it's kind of fun.
Yeah, yeah.
So if we have you, and you guys can do this along with us. So we're going to say pa, pa, pa. Ready on the count of 3. 1, 2, 3. Pa, pa, pa. So obviously we're smacking our lips together.
Yep, that's looking at that lip closure. So are you able to take both of your lips, pa, and also, this is kind of nerdy too, but getting that intraoral pressure. So
pa.
Yeah, so to blow that air out and to make that sound clearly. So pa is the first sound that they test. The next one is ta. So with the T, putting your tongue right behind your front teeth.
Ta,
ta, ta, ta. ta. Yep.
You're striking. And the pa sound is going to use the seventh cranial nerve, the cranial nerve that runs your face. So I may do that as a check for your seventh cranial nerve. You're doing it for a check to make sure that, you can close your lips.
Yeah.
And then the ta sound, where you use your tongue to hit your teeth, that's testing a different part of your brainstem. That's looking at your tongue, your 12th cranial nerve.
Yep. So it's crazy, just these little things. Again, we don't even think about them in our daily life.
Pa, pa, pa. Ta, ta, ta.
And then the last one is ka, ka, ka. So that tests the back of your tongue. So what your tongue has to do is raise up and make contact with your soft palate, that thing I was talking about earlier.
So let's try it together. On the count of 3, we're going to say the K sound, ka, ka, ka. And I really want you to kind of think about where the sound is generating from.
Mm-hmm.
Ready? 1, 2, 3. Ka, ka, ka. And then by listening, we can hear sometimes when it's not right.
Right.
So if I say gah, 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 what does that make you think about?
Yeah. So that's that kind of a regular articulatory breakdown, and that's super nasal. So I can tell that the air is coming out.
Gah.
Yeah. So it all has to do with where the airflow is and where your articulators are contacting. And so also sometimes, so then we put them all together. So we get really crazy.
Ready? Let's do it. So on the count of 3 together, we'll say patika, patika, which actually is testing a lot of cognitive processes, because you have to make all these muscles. So
absolutely.
On the count of 3, we're going to do some patika. 1, 2, 3. Patika, patika.
Yep.
That's awesome. Someone wrote in, no, rah, rah, rah. Yeah. So these are things that the speech pathologist may do, or that I may do, as an assessment to understand where the problems are, which then lets us jump into the discussion you had about how to try to improve upon them.
Yeah. So that's kind of the stuff with the dysarthria. So again, if you're experiencing some of these issues, it definitely doesn't hurt to reach out to your physician, who can give you more information and refer you to a speech pathologist in your area, who will then conduct more in-depth testing to see what we can do. That's
awesome. Now we're going to transition to the last and arguably one of the most important areas where a speech pathologist can really impact the quality of life of people with MS. And that's with cognition.
Yes.
Now, before we do that, guys, you know what I'm going to ask for. I need some flames. So go ahead and flame up that chat one more time. Let Caroline know that you are loving her joining us today and the education that she's providing, upping our game. Certainly, I'm learning a lot. So go ahead and flame up the chat for me and let her know that you are here and that you are excited. And Brad is kicking us off. Wade is kicking us off. Angela's in the house throwing up some flames. All right, let's get the whole chat full of flames. Let's let her know that we are loving this education.
Well, I'm loving being here. This is so awesome. I'm having such a blast.
This is great. Mary O is participating. Super duper. All right, thank you, guys. I think we were successful with the flames. And Caroline, if you want to take us into an area of MS, which is extremely important.
Yeah, absolutely. Yes, for sure. So cognition is kind of this umbrella term that relates to all the different mental processes that we do on a daily basis. So things, again, that you probably don't even think about. Memory is a huge one. So both immediate memory, if someone says something to you and you're able to say it back to them or recall it right away. Delayed recall. So if someone says, you talk to someone on the phone, they say, hey, meet me, at the coffee shop at 3:00. And then 10 minutes later, you're like, wait,
what am I supposed to be
doing?
doing?
What am I doing? So that delayed recall. attention is a huge one. So being able to attend to a task, and there's different kinds of attention too. So sustained attention, just being able to concentrate, divided attention where you're having different things going on. So maybe you are making spaghetti on the stove, but then you have garlic bread in the oven and you need to be able to monitor both things at the same time.
While helping your kid with homework.
Yes, absolutely, of course. And then the dog's barking in the background, and then you got like a whole thing happening.
And this is such an important thing to talk about. When people impacted by MS experience cognitive difficulties, it's typically this prefrontal attention executive functioning thing. So it's not that you don't know who you are or where you are.
Yeah.
It's that you're not able to take in the information that someone's saying to you. And so if you can't attend to it, you can't remember it.
Exactly. So attention is kind of like that first step. Like, are you able to engage and take in this information? And then the memory part of it is like, are you able to do something with that information? Can you recall it?
If I think about an example of attention, I'll create a situation where husband's watching football, wife is in the kitchen, all right, hypothetical. And wife says, bring me your dishes. And the husband says, he didn't really listen. He's just kind of watching football. And then a couple minutes later, the wife comes in and says, why didn't you bring me the dishes? And he says, I didn't hear you. All right, well, I mean, he heard sound, but he wasn't attending to it.
Exactly.
Now, this is an example of football, but in MS, it's not that the person's not paying attention. They may be like locked on
Right
and desperately trying,
Yes.
and they can't remember it.
Right.
And so that's the aspect of cognitive impairment that I see most commonly with people impacted by MS.
Yeah, for sure. So that's a huge one. The attention and memory, problem solving with like that complex problem solving. So are you able to, if there's an emergency, what are you going to do? Your car breaks down on the side of the highway, kind of working out these situations. Your son's running late to soccer practice and, you have to also take your daughter to ballet, like all these different things. And then just speed of processing in general. So how quickly are you able to complete tasks without, that kind of brain fog kicking in? So those are kind of some big overarching cognitive areas that we commonly see in people with MS. And speech pathologists are so lucky that we're able to participate in the rehab process for these things. So I'm really passionate about the cognitive area. I think cognition is so cool. And again, it can be very individualized based on where your lesions are, but in general, these are kind of the things that we're seeing. And so these changes occur in almost half, or would you say, if not more?
I would say probably 50 to 70% of people impacted by MS may experience some degree of cognitive impairment.
Yeah. So
that doesn't mean gloom and doom and that, you're going to end up in a bad situation.
Right.
It just means that this may be a symptom that we have to grapple with.
Right. And so there's two kind of treatment areas for the cognitive aspects. Number one would be pharmacologic treatment. So medications that you can take. And there's a lot of studies and ongoing research looking at these different things. But I'm not going to comment on that too much since that's not really in my scope.
More over in my camp.
Exactly.
There's a lot of videos on the channel about cognition. And there's medicines like stimulant medicines that trick you into being more awake.
Yeah.
Another area, just to talk pharmacologically for 2 seconds, is treating depression.
Oh, yeah.
Because a lot of people with MS can suffer from depression, which worsens their memory.
Yeah.
And it's called pseudodementia.
Okay,
so we may help them think clearly by treating their depression.
Yeah, that's super interesting.
And then the last one I want to point out is all too often we give them medicines which have side effects that impair cognition.
Oh,
so I give you an anticholinergic for your bladder and it impairs your thinking. So there is a lot of work on the pharmacology side. But let me kick it over to you and tell us about how you guys in speech pathology help, because it's really cool.
Yeah, it's super neat. And so the one thing that we are huge proponents of are compensatory strategies. So things that you can implement in your daily life to help with some of these different things. So first, I'm going to talk about internal memory strategies. Then I'm going to talk about external memory strategies. Then I'm going to teach you a little mnemonic to wrap things up and kind of a take-home message for the night. So internal memory strategies. So those are strategies that don't require anything except for your brain. So you don't need any extra stuff, no pencil or paper, no calendar, just your brain. So internal memory strategies are different things you can do to help remember certain things. So the first one is rehearsal. And again, some of these things I'm going to talk about, you guys have probably already done and not even realized it. So the thing that we kind of do is just draw your attention to it and kind of train you in implementing these strategies in your daily life. Yes. So rehearsal is just repeating things in your head, going over them. If you're going to the grocery and you need milk, bread, eggs, milk, bread, eggs, milk, bread, eggs, going over it in your head. So just kind of repeating those things. Rehearsal, thinking like if you're rehearsing for a play, you say the lines in your head to prepare. You can say that with your grocery list or whatever.
Repetition is the mother of learning.
Yes, exactly. The next one I want to talk about is visualization. And I really like this strategy.
Me too.
So creating like a mental picture in your head. So sticking with the grocery store example, you're picturing, going to the store and you're going to go in and you're going to go to the right and you're going to find the fruits and vegetables there. And that's where you're going to get your oranges, your bananas, and your apples. And then you're picturing going to the left where you're going to get your milk and your eggs. So really creating this picture in your mind can help things stick a lot more clearly. So visualization is a huge one. The next one is association. And I think this technique is really great for learning names, especially if you have like different therapists or doctors or, even neighbors, like people that you're meeting in your daily life. So associating something new with something familiar. So say you go to a new doctor and they have the same name as your childhood best friend. So thinking, oh, my new, cardiologist has the same last name as, the Smiths who lived next door when I was growing up. So trying to make those associations just really helps things stick in your brain a lot more clearly. So I really like that technique. And then the last one I want to hit on for now is it's called chunking. So putting things into groups. And I love this one, especially, again, we'll go back to the grocery store example, but when you need to remember things that kind of have some similarities. So if you're going to the grocery, it makes a lot more sense to put all your fruits in kind of one, part of your list, and then all your veggies, instead of writing down broccoli, bread, cereal, banana. Like that's not very efficient,
You're
right?
not going to find it in the order either.
Yeah, exactly. So not only is it inefficient, but it's also harder to remember because it's all over the place. So putting things that go together in a group, picking that category and kind of sticking with it. So all your fruits together, all your vegetables together, all your snacks, whatever. So those are just some internal memory strategies. So things that don't really involve anything else, just involve your brain. The next set of strategies I want to talk about is external memory strategies. So as you might guess, those are things that require something else. So they need some sort of extra stuff. So whether that be a pencil and paper, a calendar, an alarm, your phone, yes, is huge. There are so many cool things you can do with your phone. So talking through a couple of those. Writing things down is huge. So note taking, making sure that we're, documenting things. And not only is it good because it trains your brain, you're like actively engaging and, writing things down, but then it's something physical you can go back to. Yep. It's like, it's not just in your brain and then it's gone. It's like, oh, well, I have a piece of paper that I can look at.
I want to highlight that because that's a technique which is used in medical training. So when I was a medical student and then a resident on the wards, we were expected to make lists of things we needed to do for each patient.
Yeah.
So for the first patient, I will make an open box and then I'll write, check vital signs. And during the beginning of the day, we would round and the interns would all have their papers and we would make all the lists of the things we need to do. Yep. And we were allowed to leave when everything was checked off.
Yeah.
And I have continued that technique. Like, so for example, if I have a Saturday where I'm going to be doing some cleaning, I may whip out a piece of paper and write down all the things I want to get done and then periodically through the day, check them off.
Yeah, exactly. And it kind of gives you that sense of accomplishment too. Like not only does it keep you on track, but it's also, you're like,
sometimes I'll write something down. Sometimes I'll write something down I did so I can check it off.
I've done that too. I think it's so funny. Like I'm like, I did this an hour ago, but check it anyways.
And you can do that on your phone too. So you can keep running lists on your phone and then come back to them.
Yeah, absolutely. So writing things down is huge. Calendars or day planners are awesome. So calendar, you can have your whole month there to refer to, but I also like having day planners. So things of like what you're doing each day. So maybe, you have a doctor's appointment at 10 a.m. and then you have to pick up your son from soccer at 3:45 and then you're going to dinner at 7. So those exact day things, having those written down as well. And then the last one I want to talk about is alarms. And so I know A lot of people think about alarms in terms of getting up in the morning. Nobody likes when their alarm goes off, but I also really love setting alarms to remind to take medication. I think it's a great technique that you can have. So, you can do them on your phone, recurring alarms. So maybe at 8 a.m. every day, you're going to have your morning medication alarm go off. And then it reminds you every single day, and it won't shut up until you do it. And so it's a really nice kind of external way to remind yourself to take medication. And along those same lines, just throwing in another plug for pill boxes. I am a huge proponent of using pill boxes to organize medication.
Me too.
I think especially because a lot of people with MS are on a handful of medications. It's not just
7.
Yeah. So like, it's not just 1 or 2 where you could just grab the bottle. 7 medications is a lot, and likely you're taking them at different times of the day. The dosage is different for all of them. So having pill boxes can help you keep all of that in line. And it also takes the stress off of doing it every single day. So maybe on Sunday, you integrate it into your routine where, you sit down with your cup of coffee and you organize your pill box for the entire week. So it takes that stress off.
That is an excellent recommendation. And there's another added advantage during the course of the day. If you're not sure whether you took the pills,
Yep, I was going to say that
you
next.
just look and see if it's in there. If it's in there, you didn't take it.
Yep.
If it's not there, then you took it.
Yep, exactly. So it's keeping you organized and it's keeping your memory in check. So those are some external memory strategies that I think are super helpful for anyone, but especially people with MS who might have these cognitive dysfunction symptoms.
Super helpful information. I hope that you are gaining an understanding of the deep impact that a team member with this background in speech pathology brings to the table, pun not intended. Today we talked about 3 areas of focus which are really, really important. One of them being swallowing safely. One of them being speaking so that others can understand you. And the last one is upping your game with thinking and memory so that you can live your best life with MS. And I just want to say thank you so much for this
You're
didactic.
welcome.
This was a tour of force. Now, if you guys are up for a couple question and answer, fill up the chat one last time. Let me know that there's a lot of love in the room. Let Caroline know that we are so appreciative that she's given up her evening so that she can teach us. Go ahead and flame up the chat, and then we'll take a couple handful of questions before we wrap up tonight.
Sounds great.
All right, guys, show me some love with the flames. Here we go. All right. Yeah, we got it going on. That's fantastic. Okay. Kathy Keats is helping out. Even so. All right. That's fantastic. Thank you very much. That's awesome. So what I'd like to do now is ask you guys to throw out some questions. And our moderators have been doing a bang up job of posting questions. And so I'm going to scroll back and see if I can find any of those. And then we'll also look forward for a couple questions. So Matt, our moderator, has been crushing it now. Really helping out a lot. And thank you, Darla, as well. I'm just scrolling back to see if we can find some of these earlier questions. So even so it is well asks the following question. So I'm super curious, she says, about neuroplasticity. Do you have exercises and devices to help create new neural pathways?
That's a really good question. Neuroplasticity is very, very cool. And so I don't want to, say for sure yes or for sure no. But the idea is that you're continuing to build those connections. And so with those exercises specifically for swallowing, just training those muscles to do what you want them to do. So strengthening them and kind of, again, sending that message and trying to train your brain so the message doesn't get kind of messed up along the way. And so I don't want to, endorse anything in particular because, again, I'm just a student. But the idea here is that, yes, you're training your brain on how to do these things correctly.
What about learning a second language? So what do you think about that? Is that something that could be of value, or would it just complicate things?
I think I am all for learning second languages. There are so many studies that show that learning second languages at any stage in life, whether, you're a baby and you're brought up bilingual, or, you're 55 and decide to, pick up Portuguese, is so incredible for your brain. There is so much to be said about being bilingual, and not even becoming fully bilingual, but just picking up, a different language and forcing your brain to do something new. So we talk a lot about cognitive stimulation. And that's the idea that you're challenging your brain to do all of these cognitive tasks, but in a new way. And so again, we use language every day, but if you're challenging your brain to do it in a different way with a different language, or maybe you're, teaching yourself to write with your other hand or something, you're processing language in a different way. It can really make those new connections with your brain. And it's very cool. There are so many studies, like kids that are bilingual have like insane abilities cognitively. And so if that's something you're interested in, I definitely think that could be beneficial. Just there's so many apps too. Just if you're interested in something like that, language processing is really cool.
Super, super cool. So another question comes from Kelly, who writes, is it normal for your vocal cords to make a tick-tick sound when you swallow?
So swallowing can be audible. And so sometimes when we do those exercises, like that effortful swallow that we talked about earlier, you can hear your swallow. So it is like everything kind of going down. If it's happening all the time, I don't know for sure if that is something to look into. If you're swallowing consistently and it's audible, if you're feeling like something's going the wrong way and then your vocal folds are kind of making a different sound, that's like that protective mechanism. So your vocal cords are like the last ditch effort in your body's defense system for things going, so that your vocal cords sit right on top of your trachea. So if things start going the wrong way, your vocal cords should close and protect them. But if they're kind of making some sort of sound, that could indicate that they're kind of trying to protect your airway. But if that's something that's happening often and it's concerning to you, I would definitely get it checked out.
That's fair. Now, here's a question that I really liked. It says, and this question is from Karen, who writes, why is trouble swallowing not always there? And this is all too common with many different symptoms in MS.
Yes.
And it drives people bonkers because they say, wait, no, I'm not making it up. It was there and now it's not. And it's confusing. And so I think we have to keep in mind the underlying pathology of MS.
Absolutely.
And when you start your day, you start with all the energy, all the cognitive and functional reserve. You got all your spoons, so to speak. And as the day proceeds and you use up those spoons, you can become tired, and you can become tired motorically, and you can start to have slurred speech as the day goes on. I'll never forget when I was living abroad in France, I was talking to one of my friends and it was late at night and he started cracking up laughing because I was in French slurring my speech. I wasn't drinking, but what happened was I was so freaking tired from trying to speak a foreign language all day that at the end I just couldn't do it anymore.
And that's something I wanted to talk about too. I want to talk about the swallowing thing specifically, but also just in general, that like cognitive reserve kind of starting to die down. We talked a little bit earlier about being an advocate for yourself. And so with those cognitive functions, a lot of times people have like kind of peak times of the day. So maybe you're a morning person and you know that you're at your best in the morning, or maybe you need a couple hours and you kind of start to really kick into gear around noon. But being able to advocate for yourself and say, look, in the evenings, I don't feel too hot and my brain kind of starts to shut down. I need a brain break right now. And so that just goes along. That can be with any number of MS symptoms, but just bringing up the cognitive stuff too and taking those brain breaks because you don't want to get cognitively overstimulated and then everything shuts down. But to go back to the swallowing thing, it can, that underlying pathology of MS definitely is impacting it. And externally too, it can be impacted by specifically what you're eating and drinking. So maybe you notice every time you eat a salad, it gets weird. The crunchiness of the lettuce, there's a lot going on and mixed with the dressing, that mixed consistency. So that can have something to do with it too. Or with certain liquids, maybe every time you're drinking liquids, you're having issues. So being mindful of actually what you're eating and drinking when you notice those swallowing difficulties and kind of taking note of that can really help too, especially if it progresses and you do see a speech pathologist. Giving them a really detailed record can give them...
This is okay, this is not okay.
Yeah, exactly. Right.
That helps.
Yeah, for sure. Definitely.
Now, we'll end with this very, very important question. And so Jessica asks a critical question. She says, coughing fits after eating, could that indicate swallowing issues?
Yes, 100%.
If you're coughing after you're eating, you need to tell your neurologist so I can send you to Caroline and help you stay safe.
Yes, 100%. I would say coughing is like one of the #1 symptoms of swallow dysfunction. And so if you're noticing that often after you're eating, absolutely contact your physician, and they will get you set up with a speech pathologist to see exactly what's going on, because that's a big sign. Because again, that's your body's way of trying to protect you. So the cough reflex is your body's way of trying to get things out of your airway. It's your vocal folds coming together and saying, hey, stop, no, don't go down that way. Yeah, back up. And so that's that last ditch effort again of you trying to get those things out. And so this is your body's way of telling you, hey, something's going on with swallowing. Let's get this checked out.
So don't blow that off. Don't blow that off.
Definitely.
We've been talking for a little over an hour and 9 minutes. There's been 122 people that have jumped online.
So crazy.
I am so very, very appreciative. Thank you very much.
Yes, thank you.
You know, I hope that later you look in the chat on the replay, because I think you're going to see a lot of love from people that were so appreciative.
Oh, well, thank you.
So let's all thank Caroline and express our gratitude. Feel free to drop a thank you in the chat so she can see it later. Now, how would people find you if they wanted to touch bases with you down the line? Is there a good way to do that?
Yeah, so I have an Instagram. If you want to reach out to me on Instagram, I'd love to answer more questions.
All right, I'm going to put the Instagram in the chat.
So Carolyn Conway.
One word?
Yep, _.
All right. So at Carolyn Conway _, that's the Instagram. Fantastic. Yep. So we can find you that way.
Yeah, absolutely. Thank you again, everyone who tuned in tonight. This has been such a fantastic experience for me. I've really enjoyed interacting with everyone and getting to, talk a little bit about something that's near and dear to my heart. So thank you again. And thank you, Dr. Boster. This has just been so cool, being able to come into the clinic, shadow here, gain some, hands-on experience, and then do some education.
Awesome. Thank you, everyone. Have a fantastic night. We'll be doing this again next month, and we'll be prepping people and telling them when. And I'm very hopeful that we would get you to come back sometime. Would you be willing to come back and join us?
Absolutely. Yes,
Awesome.
for
I think
sure.
That's fantastic. All right, guys. God bless. Be safe, and we'll talk to you really, really soon. Take care.